So you presented today complaining of abdominal pain, nausea, vomiting, and constipation. You were febrile on arrival here. On my assessment, I did find that you had a lot of tenderness to your lower left quadrant. And I also found on your CBC that you had an elevated white blood cell count. So the combination of all of these symptoms, the abdominal pain with the tenderness to the left lower quadrant, the nausea, vomiting, the marked change in your bowel habits, the fever, and the leukocytosis, all of those symptoms combined are leading me to believe that you may have diverticulitis. So diverticulosis is just the presence of diverticula. Diverticula are these pouches that actually form on your digestive tract. You can see them here, these bulging pouches on your digestive tract. Diverticula are most commonly found in the lower part of your large intestines. Diverticula are just more common the older that we get. Statistically, around 58% of adults aged 60 years and older have diverticula. Diverticula don't normally cause any problems or any symptoms. The issue arises when these diverticula become inflamed or infected, and then that develops into what we call diverticulitis. And diverticulitis is going to be accompanied by the symptoms that we talked about, the abdominal pain, nausea, vomiting, fever, leukocytosis, the marked change in your bowel habits. A couple other things, differential diagnosis, a couple other things that could be going on that we'll want to rule out are irritable bowel syndrome and a small bowel obstruction. We can differentiate between these three diagnoses by doing a CT of your abdomen and pelvis today. If it is diverticulitis, we would start you on antibiotics, and that way that may warrant a hospital admit. But that's something we'll discuss a little bit more. If this is diverticulitis, we want to talk to you about preventing this from happening again in the future, from you developing diverticulitis. And a couple ways that you can help, to prevent this from happening again are to quit smoking cigarettes, to come up with a good exercise regimen, and to increase your fiber intake and your fluid intake as well.